The purpose of this podcast is simple. We want you to get to know your doctor before meeting them in person, because you're making a life-changing decision and time is scarce. The more you can learn about who your doctor is before you meet them, the better that first meeting will be. I'm your host, Eva Shea, and you're listening to Meet the Doctor. Welcome back to Meet the Doctor. My guest today is Dr. Alex Rivkin, and he's the founder and pioneer behind Westside Aesthetics in Los Angeles. Welcome to the podcast.
Thanks. It's nice to be here.
It's nice to see you again.
Indeed, it's been a while.
Yes. So tell us how you got started and how you started it specifically in aesthetics in the most competitive market on the planet.
Well, it didn't used to be that way. So my training is ENT. I very early on realized that what I really wanted to do was aesthetics. And these tools came out, these fillers and toxin, and it was a whole new world that was being born. And I thought it was really exciting and really interesting. And what I thought was really exciting and really interesting was, what can I do without taking someone to surgery? And I, started doing things like noses and chins and all these non-surgical procedures. And there was an imperative to explore and refine and develop and kind of get these procedures as safe and as effective as possible. Because if I can save people a trip to the operating room, I think that's pretty amazing. So that's been essentially my career, is just trying to, develop and popularize and really kind of, let people know about how these, what the power of these procedures are and how good they are. Recently, however, that job has been very complicated.
How so?
There's so much disinformation about fillers and toxins and biostimulators out there on social media that it's actually been quite frustrating, because people believe all sorts of things, and they come into the office and they're like, oh, well, I just heard that filler is just awful and is inflammatory and is going to do all terrible things to my face and it's going to migrate around my face, and like all sorts of things. It's being promoted by people, sometimes surgeons and, plastic surgeons and some, other people. It's really too bad.
I've heard a lot of that too. It shows up in the data. I think there was a wild swing in 2024 where, hyaluronic acid fillers went down and biostimulators went up. And I think you just pinpointed one of the causes, at least, of that social media, people talking about what's going on with filler. But what has your personal experience been?
Well, that and just a fear, like a not knowing who to believe. It's tough. I mean, I've been working with these tools for 22 years, so I know what they do and what they don't do. It's tough because I know they're safe and I know they're effective, and I know that if you do it right, the results are really quite very, very good, very precise. But the thing is that some of these guys that are on social media see the side effects, they see the bad work, and they fix the bad work, and then they go on social media and they generalize about the things that they've seen as being an issue with fillers or toxins, as opposed to being, an issue with the hand that delivered those particular fillers and toxins, and it makes people scared. It's too bad. It's unfortunate, because people shouldn't be getting facelifts in their early 40s or late 30s. They really shouldn't be doing that. Message should not be fillers are dangerous. You should get a facelift instead. That's bonkers.
When you say it like that, yeah, it certainly does sound bonkers.
Most of my nose injection practice is revisions, right? Most of the people that come to me to inject the nose are people who have already had 1, 2, 3, 4 rhinoplasties, right?
Real surgical rhinoplasty.
Surgical rhinoplasties.
Yeah.
And they come to me because they're like, they want an alternative. They're like, I don't want to go into the knife again. This has been a very difficult, expensive, and horrible experience. Is there any other options? And a lot of times I can provide those other options because the fillers are so precise, and I have temper as well as permanent options.
Are you known specifically for that?
Yeah. So I'm known specifically for the nose and injecting the nose. And more than anything else, I'm known for revising and helping with post rhinoplasty problems. So I could go on social media and be like, rhinoplasty really sucks. It's just like, look at all these people that have been like mangled with rhinoplasty. But I know that's not true, because most rhinoplasty results are quite good. And I see the problems, but it's not. That doesn't mean that everybody's like that. So I don't know. I think it's frustrating.
It certainly is. The other common thread here is that people are hearing all of this on social media. And
Yeah.
I have kind of a strong opinion that not everybody finds their doctor on social media. So
Yeah.
do you agree with me or
Yeah.
disagree? You
I
do.
very much agree with you. I very much agree
Yeah.
with you, because it's just the problem with social media. You need to talk to people. You need to do research. There's no People look for shortcuts, but there's no shortcuts. You need to do your research. You need to find. You need to talk to people, and you need to get a sense of who in your community is good, and talk to doctors. My patients ask my advice, and I give them my honest advice as to who I think is actually quite good, and who will communicate well. You know what I mean? Because it's not just technical skill; it's also communication. So you want to have somebody who understands what desires you want, and doesn't do the opposite of what you're asking for, which which can happen if they don't listen. So I'll make those kinds of recommendations. The thing is that going just by social media rewards extreme views. It rewards controversy,
Yes.
rewards stuff like that. And so if you go just by social media, it becomes challenging, because is the most popular person on Instagram popular because they're so good? Or is the most popular person popular because they have all these controversial views that attract attention, attract social media clicks, and all this kind of stuff?
Well, and
So
then the controversy starts to seem like the norm, which it
yeah,
absolutely is not. It's all the outliers, right?
that's right. That's right. So I think people need to be careful about using social media as their sole source of referral. It's very, very useful, of course, to see before and afters, to get a sense of the person that you're thinking about going to, get a sense of their office, but it shouldn't be the only thing you use.
I wish that I had not spent so many years of my life thinking about this particular problem, but I think when we're the patient, we want evidence. We want to know, where do we get the information that helps us make a good decision. And in the past, we had photos. That's great. And we had reviews. We still have both of those things.
Sure.
But I think the bigger challenge is you need the quantity of those things to have confidence. You need a lot of photos and you need a lot of reviews.
Yeah.
And then you also need a little bit of knowledge to know what it is that you're looking at. And then compound that with how much noise there is, which is what you're talking about. Like, it's
Yeah.
put us in not a very good place. So I
I
hear
agree.
you. Yeah. Well, we got philosophical. We were supposed to be we are talking about you. I think the way you're thinking about it is really refreshing. And I wonder, how do your patients find you? And do they say things like, I love you because you're telling the truth? Or, what do they say to you when they show up for the first time?
Some find me on social media, and they like that I am fairly straightforward in posts, and that I kind of challenge some of the myths that are going around. And I think that's great, because then I attract the kind of person that I want to attract. So, and we think similarly, which is nice. Otherwise, it's word of mouth a lot of times. It's people who are very happy with their results telling their friends, this is who you should go to. The other thing that's interesting, actually, is, and this is new, and this is, I think, where the future goes, is AI. I was just talking to a patient, and just like 15 minutes ago, and she was mentioning that when she was mentioning that she was doing research on ChatGPT, and I was like, oh no, this is not great.
Yeah.
But this is a established patient of mine, so it's fine. But she was saying that she was kind of wondering about a question, so she was doing some research in ChatGPT. I said, okay, And then she said, and by the way, she goes to me, when I type in non-surgical rhinoplasty, you're who ChatGPT recommends. And I'm like, well, there's clearly no higher authority.
Clearly.
I am very pleased that
That's
that's the
good.
case.
I mean,
Yeah.
it does a pretty good job. And I think what I like about those results is they're written in a really friendly, like warm way. So it feels like your friend is telling you,
Yeah.
but your friend is not very smart and really makes a lot of mistakes. Like
Yes.
last week, I was looking for a breast surgeon in San Diego, and ChatGPT told me the surgeon worked in somebody else's practice altogether where she's never worked.
Yeah.
And I thought, wow, if they saw that, their heads would explode.
Yeah. It does. It hallucinates quite a bit. So you have to
Yeah.
be, I mean, I think this is probably temporary, that it'll get
Yeah.
much better. But I mean, unfortunately, this is the track we're on. There's no denying that AI is our future.
My friend who's a developer has a scribe tool for an EMR. And so, the doctor gives the notes, the scribe AIs the notes right into the chart. Well, he told me on Sunday that the doctor kept calling and saying, these notes are so strange and they're totally inaccurate. I don't know where they came from. And so they figured out that his microphone wasn't on and he was recording blank files and uploading blank files. And the AI was hallucinating the notes completely from beginning to
Oh my
end.
God.
Yeah.
That's hysterical. Wow.
Yeah.
That's impressive. It can
All
lose.
of the normal practical people in the room said, shouldn't you just reject the file if it's blank? And he was like, what? What do you mean? No, that's not what it does. What do you mean that's not what it does?
That's crazy. That is crazy. It shouldn't be like that. Yeah.
Yeah.
Well, we'll see. We'll see how it goes. But yeah,
Good
it's
stuff.
it's interesting. But I do think that the most, in general, of course, still word of mouth is still the best.
It's probably more important than it ever has been.
I think so too. Yeah, because there's a lot of because as you say, there's a lot of noise. That's right, and that's the way around the noise, because the person telling you this is someone who's trusted and has the experience to tell you about.
I went there myself. I had a treatment. It was great. They were great. Like, what more evidence do you need than somebody you know?
Yeah.
Where are we going to go? I don't know the answer to that, but my way of helping is to get doctors' voices out there and feed the AI with things that are real. And podcasts do that so, so well.
Yes. True. I appreciate that. I think that's great. Real information from people who understand and who have the experience to talk about it.
Mm-hmm. Well, and that's why this podcast exists, because we just want to know you. Like, that's really, it's that easy.
Yeah.
Okay, there's a beautiful photo over your shoulder.
Oh.
That's not just a frame with a stock photo in it.
No.
No.
That's my wife. That's my lovely wife. The best decision of my entire life. And we have, and
Oh,
here there's a, the other ones.
two of them.
Yeah, two of them, two
Mm-hmm.
boys. One is 7 and one is 6. And they're in second grade in kindergarten. So they're lovely as well.
Yeah. Mine are also in second and kinder, and they're
Oh,
just like a barrel of laughs or monkeys, depending
yeah.
on the day.
Yes, exactly.
Yeah. Yep. That's good. How has work changed since they came along?
I try to either take them, if I go to a conference, I try to take them with me, which is fun. If she has time, because my wife's an architect, so she has, her time is limited. But when she can, they accompany me, and then we take a little bit more time and make a little vacation out of it. But it's the conferences aren't quite as much of a draw these days. I want to be home. I want to see them. I want to hang out, just spend time with them. So that's you know that's the thing. My belief is that they will benefit from having another language, and so I speak Russian, and so I try to get them to have be essentially bilingual, and then my wife speaks Chinese and grandma speaks Chinese, so they understand Chinese, so that's kind of good. So I think that that's good for, kind of the future. And their ability to switch languages, I think, translates into an ability to handle different kinds of situations. I think we'll see.
What about your work family? Who's there in the office that supports you?
A lot, a lot of people, a lot of people, and it's funny because when I started in on this, my office was, I mean, of course, it was much smaller, and everything was much just kind of smaller. And I've expanded, and I realized that I just kind of like felt, okay, well, I just went, well, this is the next step, and this is the next step, and this is the next step, and to expand, the business. That's not kind of self-explanatory. That's not intuitive necessarily. That can run into pressures that have to be managed in different ways. And so it's the business side of this. I didn't have to worry about at the beginning because small. It was small and the overhead wasn't huge. But now I have to think about these things. I'm supporting 30 people. It's a lot.
How many of them are providers like yourself?
Um, about 7. Not everybody's full time. There's
Injectors, laser, like kind
yeah,
of take us through the services and the people that you have there.
yeah. So injections, lasers, devices, energy devices, estheticians. There's a person who does brows. That kind of stuff. So all aesthetic stuff.
Is there any non-surgical technology that you're excited about or looking forward to?
I've always been excited about skin tightening technologies, but
We all have.
yeah, but they've always been disappointing. I got to say,
Yes.
they have not. I've been excited and then I've been let down. I feel like Charlie Brown in the football a
Uh-huh.
lot of
Over
times,
and over.
over and over. No, this is the one. This one. This is the one. No, no, no. That's trash. This is the one. This is the one that'll be revolutionary.
Mm-hmm.
I don't know. I'm always watching to see what new stuff comes out. I'm no longer quite as interested in being the first one out of the gate with new technology. I have too many very expensive doorstops in my office, with devices that I don't use and technology that's just doesn't live up to expectations. So most of what we do is really injectables as opposed to technology stuff. I find it to be more reliable.
Well, and the injectable products have come so far too, I think. When you and I started working on these things, 20 plus years ago, there was just Botox and there was just Restylane and was there anything else? I mean,
And there's collagen, but
collagen,
nobody wanted that.
right. But now there's a whole range across every single brand.
Yeah. I think I was one of the first practices to exclusively focus on non-surgical aesthetics. Because
Mhm.
there was no nurse-run med spas back then. There
No.
was nobody was really focusing on this. There was dermatologists who did this stuff. There was plastic surgeons who did this stuff, but there was very few practices that were specifically focused on non-surgical aesthetics. And I thought that was interesting, and I liked being the person that was really going to devote my practice to it. Nowadays, that's no longer the case, and there's a lot of these practices, and there's a lot of these med spas, and some are quite good, and some are not as much. So it's difficult to know who to go to. It's difficult to know who's good or not.
Yeah, it certainly is. How did you land in Los Angeles in the first place?
Oh, because I'm from Boston,
Hmm.
and I went to school in New York, and I went to school in New Haven, and my residency was in San Diego, and I thought I had plenty of memories of Boston and New York winters to know that there was no way in hell I was moving out of California. So I liked San Diego, but I wanted more of a city. Like I wanted more diversity. I wanted more arts and culture. And I had friends in LA, so I just kind of settled here. And I knew that the lifestyle was what I wanted. It's just kind of a more accept. It's New England there's a culture in New England. It's a little more rigid, LA is more accepting and more kind of relaxed about things. So it was interesting. It was a nice transition.
No regrets, I'm sure.
No, no.
What did it feel like to go out on your own?
It was exciting, and it felt natural, and it felt good. And it really felt like this was where I belonged. I just fell into it, and it was good. So it's been going on for a while.
One question I love to ask is if you've never been to the practice, if you're a prospective patient, what is the experience like coming there for the first time?
I think the experience is warm. I think the experience is we have dogs. Oh yeah. So here's here's what you don't know about me. I have a Cocker Spaniel Dachshund mix named Sammy, and he's very, very cute. And he's not big. He's pretty small dog. He's about 13 years old. I've been bringing him to the practice with me every single day for 13 years. And he just like lives here. And then some of my employees also bring their dogs over as well. And it's great. And people love it. They absolutely love it because they're like little therapy dogs. They're sitting in the waiting room and they're kind of nervous because they know they're about to get stuck with needles. And these little dogs come wandering over and they're like, they pet them and they calm down. I think it's nice for people, but I like it. I like having those guys around. I think it makes it a more, and because that's the thing. I want it to be a welcoming, warm, certainly, of course, comfortable and boutique kind of place, like the kind of place that you go to for world-class results, but not like kind of attitude,
Mm-hmm.
like I don't need that. So I think that's what people really, respond to, is that I hire specifically, front desk and back office people that are warm, empathetic, and pleasant, and without drama, without attitude. And that's been the brand.
Well, I don't see the dogs on your Instagram. Why don't they get to be the stars of your
Oh,
social media?
They're in there somewhere. They're just not. They're not on a daily basis.
Okay. Well, here's your reminder to put them up.
There you go. All right.
I don't see any on the top anyway. I don't see any. But yeah, I was going to say, if there's no pictures, it's not real.
There you go. Will do.
That's really sweet. Your Instagram is Rivkin, RIVKIN _aesthetics. Where else can we find you online?
So the practice page is Rivkin Aesthetics. Mm-hmm. My page is Dr. Rivkin.
Oh, there's the dog.
Yeah, there we go.
In your profile picture. Oh my gosh, so cute.
Right? He's a good looking guy.
Yeah. I almost don't want to ask, how did they combine Dachshund and Cocker Spaniel into one word, like in Dumb and Dumber with the bulldog and the Shih Tzu?
You know how I do? You know how I combine in one word? Cocker wiener. Because that's what he is. He's a cocker wiener.
Fantastic.
So there you go. That's Sammy.
It's the best thing that's happened to me all day.
There you go.
Well, thank you, Dr. Rivkin.
Of course.
It was a pleasure hearing from you today, and I look forward to seeing you again soon.
Very good. It's a pleasure. Thank you for having me on. It was fun.
There's no substitute for an in-person appointment, but we hope this comes close. If you're considering making an appointment or are on your way to meet this doctor, be sure to let them know you heard them on the Meet the Doctor podcast. Check the show notes for links, including the doctor's website and Instagram, to learn more. Are you a doctor, or do you know a doctor who'd like to be on the Meet the Doctor podcast? Book your free recording session at meetthedoctorpodcast.com. Meet the Doctor is made with love in Austin, Texas, and is a production of The Axis, TheAxis.io.